BioSculpture Technology has a new approach to managing obesity and the type 2 diabetes associated with it. Two-thirds of affluent populations are overweight, and one-third are frankly obese. One-third of our children are already obese, and 80% of obese patients get metabolic syndrome. A bulging waist overhanging your belt or a muffin top is a risk factor for metabolic syndrome and a marker for visceral or belly fat. Belly fat is a noxious cellular hormone factory responsible for all the morbidities of obesity: sleep apnea, gastric reflux, hypertension, heart disease, cancers, autoimmune diseases, and most importantly, type 2 diabetes. Frequent cause of kidney failure or requiring dialysis, the indication for more than half of non-traumatic amputations, and a frequent cause of blindness. When insulin is neutralized by belly fat, sugar cannot enter your brain or muscle cells, shutting down your metabolism, sapping your energy and drive, and making you constantly hungry. Visceral fat shortens your life and reduces its quality. 7 out of 10 U.S. healthcare dollars are spent on obesity-related diseases. That's $2 trillion yearly and growing by almost 10% a year until 2030, when it is forecast to reach $17 trillion per year, with half of the world's population being obese. Till now, all we could do was starve belly fat with temporary solutions or surgery, which either restricted how much patients could eat or made food bypass parts of the intestine. The risks, complications, and trade-offs of these operations were serious and unpleasant. It was not possible to directly remove just the mesenteric visceral fat that is the cause of the problem. BioSculpture Technology has 3 allowed patents and multiple pending on methods and devices that now make it possible to directly remove this fat in a minimally invasive fashion. Last year, there were only 208,000 bariatric surgeries performed, and 15% of them were revisional. Surgeons reserve current restrictive or bypass options for brittle diabetics and the morbidly obese. However, each year 1.4 million Americans are newly diagnosed with diabetes, and there are approximately 20 million diagnosed type 2 diabetics in the U.S. alone, and an estimated 8 million undiagnosed. Endoscopic visceral lipectomy, or EVL, is a procedure that uses BioSculpture Technology's patented EVL device and is performed laparoscopically through small incisions in the belly. The patients that would benefit from this procedure are known to be at high risk for type 2 diabetes. The small bowel mesentery of an obese patient is thickened with metabolically noxious fat. The surgeon targets central areas of the mesentery. As the slow-motion animation illustrates, using the EVL device, the surgeon can safely and easily remove this fat without dangerous to and fro stroking. EVL's patented tube within a tube is gentler by design. Samples are taken to determine which fat is the most metabolically detrimental and should be targeted first. An EVL procedure may remove about 4 liters, or 8 to 10 pounds of fat, resulting in a lowered risk of diabetes. It is anticipated patients will lose 7 to 10 times that amount in body fat within 4 to 6 months after the procedure, and that the procedure may be repeated until the patient attains an ideal body weight. This new alternative bariatric surgical treatment of obesity can improve the lives of 1.3 billion people. Simply put, I want patients suffering from obesity to have longer, healthier lives because of what we believe will be a safer and highly effective procedure. We believe EVL can do for obesity treatment what LASIK did for vision correction. Our IPO is a qualified Tier 2 Regulation A offering. That means non-accredited retail investors can buy it, up to 10% of their net worth or annual income, before rather than after institutions buy in. Help us make a small dent in the universe by participating in our direct public offering that will fund an expedited development of this new approach.